In this video, we're going to be talking about paying your marketers. That's right. We're going to be talking about paying your marketers for your home health, your home care, or your hospice agencies. So let's go ahead and just get started. Now, there was a study that was conducted, and what they have said was that approximately the average paid for marketers and liaisons in the home health industry is in the range of about upper $60,000 range. So these are really high rates for me wise. But the thing that creates more problems is that a lot of marketers, a lot of liaisons are actually not producing and they're being paid for more than what they should. I always advise that start new marketers at a low base, but at the same time is to be able to create a good incentive package for them that's going to make them want to work hard in order to be able to meet their highest potential. Now, when you are creating these type of situations to be able to give them the potential to make more money for their referrals, you want to be able to adjust it depending on the type of patients that they're bringing in. You want to be able to consider the payer source. You want to consider and also tailor like certain goals on how they meet on pushing your specialty programs. For example, you want to be able to require that the admissions are new referral sources, that they actually get new referrals and not past clients. Another thing is this, right? When you create these type of incentives, you do not want to make it where it appears, and you don't want it to look where it's pay per patient only. You want to be able to create what they call a staggered situation or a staggered scale, where they're going to get a certain incentives and bonuses in regards if they meet a certain criteria. Maybe like the first 5 patient, if they get that, they get a certain incentive. And the next level will be if they bring in 10 patients. Now, let's say they bring in 6 patient only or 7 patients only. They're only going to get incentives with the 5 because they need to be able to meet the certain goals, certain levels in order to be able to receive those incentives. You want to be able to make sure at the same time is to not give too much on the incentives, okay? When I have been asked in the past, my answer to this is this: it depends on the agency that you actually have. At the same time is you do not want to give too much, and at the same time is also you do not want to give too less. And the reason for that is this: if you really have a good marketer and liaison, if you pay them too little, they will go elsewhere. And to add a quick tip to this one is this: when you hire new people, always make sure that they sign a non-compete clause with proper documentation and stipulations in it. When you are developing these type of incentive programs, make sure that your company is able to clearly explain to the liaison and the marketers the goals, as well as to be able to create a system in place in order to be able to measure the product, these services that they're actually bringing in. You want to be able to know the outcome. Like, for example, this: if they bring in a referral from a particular location, yet, okay, the resident or that patient was not admitted because it was not a qualified client to be able to be admitted within your agency, that particular referral is a bad referral. And at the same time there should always be incentives to be able to bring in more clients. And at the same time you should be able to let them know that there is also penalties if they are bringing in the wrong types of clients. Because a lot of these marketers will try to bring in everyone that they can, any whoever whatsoever, even their mothers or aunts, just to be able to get those quotas met or reached. And you as an agency don't want to waste time on patients who are really not qualified to be under your services at all. Your marketers need to be able to be trained to be able to educate referral sources on what are the qualifiers for patients to be actually admitted into your home health or hospice or home care services. Now, we actually have a cheat sheet, an educational sheet that our agencies actually, our marketers that we train, use in order to be able to create an educational based marketing strategy for one of their visits to these physicians. We teach them to actually use this sheet. It has the company's logo, it has their contact information, and at the same time as when you provide education to a physician, to a referral source, they will truly, truly appreciate it. The good ones, that is, they will appreciate what you have done. You want to be able to educate them because at the very same time is you do not want to make any mistakes. You don't want them to make any mistakes. You don't want to waste your time or their time, right? And that's how it's supposed to be, is respecting everyone. If they're educated in a particular area, you are saving them time. And that right there, guys, is very valuable. Now, if you want a payment structure for your potential marketing team, reach out to us. We definitely want to be able to give you guys on what works for us. That right there is really our main goal, is not just to keep on giving you guys these educational videos, these trainings on what you should or should not do, but at the same time as provide you guys with some amazing resources as well that will be very valuable for you. So if you have any other questions, make sure you give us a call, contact us, email us. If you're watching this video on YouTube, comment down below. That's the main goal of this company. If you have any other questions, let us know. Always understand that home health marketing is easy when you know what you're doing.